Dr. Mira Voss had long ago grown used to the oddities of a children's hospital. The staccato rhythms of IV pumps, the incongruous shrills of cartoon theme songs ricocheting down hallways, and the way a child could ricochet from laughter to tears in the span of a heartbeat. What she had never prepared for, even in the most surreal of her 20-hour shifts, was seeing a crayon-sketch teddy bear step from paper, gain dimension, and pace the freshly mopped linoleum outside Operating Theater 3. The first time it happened, she blamed exhaustion. It was a Tuesday morning in early October. An apple-crisp chill coated the glass walls of St. Theodora's Children's Hospital. But inside, the smell of antiseptic and caramel corn from the lobby gift shop cloaked everything in an oddly sweet warmth. Mira had scrubbed in at dawn for the resection of a congenital jejunal atresia in a 2-day-old, and afterward she went straight to review the chart of her next patient, 6-year-old Davy Cordero. Davy's surgeons had attempted to repair a diaphragmatic hernia at birth, but scarring had tethered lung to liver, leaving him breathless if he so much as giggled too hard. Today, Mira would go back inside his chest to free lung tissue and reinforce the diaphragm with graft. She loved pediatrics because children healed like secrets kept under sunlight. All they needed was the precise chance. Still, Davy's was an intimidating case. Mira had mapped every vessel, every adhesion. She'd even gone through the motion of the surgery twice in her mind, eyes closed, hands sketching phantom incisions in the air. He sat cross-legged on his bed coloring when she walked in to explain what would happen. "I'm drawing Mr. Huff," he told her without looking up. Crayons rolled in a centrifugal spill across the tray table as he worked. The result was simple: a teddy bear with pinwheel eyes, a zipper smile, and steam puffing from its ears. "Mr. Huff is a grumpy bear," Davy whispered, as though revealing a family scandal. "He huffs when he's scared." Mira smiled. "Even grumpy bears can't scare me out of fixing a diaphragm." If she had not turned back for a last glance, she would have missed it. The drawing's zipper mouth quivering, the flecks of red wax in its eyes glimmering like embers. But surgeons dismiss hallucinations the way sailors dismiss storms on distant horizons. Irrelevant until the sky cracks open. That night, Mira tried to coax herself into a 10-minute nap in the on-call room, phone on her chest, pager at her hip. The scratch of something heavy dragged her awake. At the foot of the bed, Mr. Huff stood, life-sized, no, larger, its matted fur shining slick in the half-lit gloom. Each exhale poured steam through an invisible seam at its back. "This is not real," she murmured, palms against her eyelids. "Real enough," Mr. Huff answered in a voice of grated wood. He extended a marshmallow stub arm and dropped Davy's chart on her blanket. "The right phrenic nerve lies entangled. Do not cut where the blue suture marks stop. Go 2 millimeters lower." She gaped. "That's beneath the diaphragm edge. He could bleed out." 2 millimeters lower, the bear repeated, then lumbered to the door, claws scratching metal. "Ignore me and the lung will tear. The boy will drown in his own blood." At the doorway, Mr. Huff's head cocked. "Your decision, surgeon." Then he simply unwound, threads unspooling, fur flattening, until he was nothing but a crumpled piece of wax paper doodle drifted against the baseboard. Mira forced herself to breathe. Nightmares could be devious, but they rarely provided specific, measurable surgical instructions. Either she was losing her grip, or something stranger had infiltrated St. Theodora's. When she scrubbed in at 600, her team noticed her pallor but said nothing. Mira's hands, usually steady as clockwork, hovered. 2 millimeters lower. It was antithetical to everything she planned. But she'd also been taught to adjust mid-flight if the anatomy demanded. She said quietly to her fellow, "Have blood units on standby. If we work below the suture line, we may need rapid transfusion." The fellow glanced up. "You're changing the plan." "Call it a hunch." The first incision parted skin like a zipper. They worked downward. And there it was. The phrenic nerve kinked around an errant suture from the original repair. If Mira had followed her map, she would have severed it. She clipped the old stitch, freed the nerve gently, patched the diaphragm graft, and closed without a vent. Davy extubated 4 hours later, breathing more easily than he had in 6 years. In the recovery bay, she spotted his drawing taped to the foot of the bed. 2 new words had appeared underneath in uneven crayon. Thank you. That should have been the end. One miracle set loose in the ward. Instead, it was prologue. Word slipped through the hospital grapevine that Mira kept her ears open. Parents began handing her drawings like talismans. A shy 4-year-old awaiting a liver transplant pressed a sheet of lavender paper into Mira's hands. A floppy-eared dog with stethoscope eyes. A teenager with Crohn's disease sketched a robot made of scalpels. Mira nodded politely and tucked each picture into a binder. She tried to believe nothing exceptional would happen again. The second visitation arrived 3 weeks later. Her patient was Lainey Choi, age 8, with a medulloblastoma like a malignant pearl embedded in her cerebellum. Neurosurgery would do the excision, but because of Lainey's brittle bone disease, Mira was tasked with installing a shunt to relieve hydrocephalus first. During pre-op, Lainey handed Mira 2 drawings, one of a carousel horse and one of a china pink balloon. Lainey insisted the balloon was called Miss Nella and liked to float in circles. At 3 a.m., Mira awoke to the soft squeak of something rubber dragging across tile. Miss Nella, now the size of a Thanksgiving float, hovered inches from her bedside. A fine lattice of surgical knots stitched the balloon's equator. You will place the proximal shunt catheter 3 millimeters anterior to Coker's point, Miss Nella whispered, voice fluttery as an exhale through a whistle. That's nonsensical, Mira said, heart slamming. Coker's point is chosen for a reason. Anatomy varies, darling, the balloon interrupted. Anterior, or her ventricle wall bleeds. Do you want to watch a child seized to death? Mira swallowed. The balloon's nylon surface shimmered, showing an image of Lainey convulsing in bed. Unbidden, Mira remembered the pediatric mortality statistics that had driven her into surgery in the first place. 1 miscalculation, 1 hemorrhage, and potential extinguished. She felt her resolve buckle. I'm doing burr holes, not ventricle walls, she argued. 1 decision sprouted from fear can poison a field of expertise, the balloon sang. Trust the craft, surgeon, and trust me. Morning brought another last-minute alteration to her plan. The OR staff balked but complied. 3 millimeters anterior, Mira made the insertion. Post-op scans revealed the tumor had displaced the ventricle. The catheter now sat perfectly within the fluid space. Neurosurgery hailed the placement as impeccable. Lainey woke, cracked a weak joke about cotton candy, and never ceased. That night, a new word materialized on her second drawing, brava. Hallucination now budded into precedent. Mira confided in no one. Part of her feared psychiatric exile. A larger part feared that acknowledging the phenomenon might make it vanish, and children could not risk her losing this new edge. She began cataloging each drawing, each visitation, each directive. Some changes were minute. Swap a 5 neuro for a 6 neuro suture, curve an incision differently to avoid hidden vasculature. Others tipped into the bizarre. A plastic T-Rex demanded a complex sequence of clamp releases, timed to the patient's heartbeat, during a portal vein reconstruction. The protocol saved the child's liver. A ragdoll in green felt advised her to let a wound fill with silence before closure, which she translated into delaying flap coverage until infection markers dropped. The patient healed without graft loss. Every success compounded the hospital rumor mill. Nurses whispered that Dr. Voss possessed hands blessed by saints or some private algorithm more advanced than AI. In truth, Mira's hands were becoming marionettes to the crayon creatures. Guilt gnawed at the rims of her competence. She stopped drinking coffee, switched to chamomile, and scoured neurology journals for references to shared hallucinations. But Google yielded only folklore, pacts with spirits made at crossroads. She started carrying Davy's thank you drawing inside her ID badge. A reminder, these visions protected children, which meant obeying them wasn't surrender. It was duty. Then came the night of December 12th, when obedience itself was tested. Javi Hernandez, age 9, arrived from an outlying clinic with a ruptured appendiceal tumor releasing mucinous sludge throughout his abdomen. Perforated pseudomyxoma in a child that young was nearly unheard of. Every minute counted. While trauma surgeons stabilized him, Mira reviewed the CT scans. Tumors like clusters of malignant snow glued over intestines. The solution was a cytoreductive surgery paired with HIPEC, heated intraperitoneal chemotherapy. Plenty of adult surgeons performed the grueling procedure, but pediatric literature contained only a handful of success stories. Javi's mother thrust a drawing into Mira's hand. It depicted a paper-white swan wearing a jeweled crown and standing on a chessboard. Above it floated a speech bubble. I am Queen Silent. I take what is too loud. Unlike the easy curves of earlier drawings, this one was almost baroque, lines curling with improbable precision. Mira felt a chill. She asked Javi's mother who had sketched it. The woman shrugged. He scribbled it while waiting. Says the queen keeps bad stories quiet. Mira sealed the drawing in a plastic sleeve, expecting to meet the swan sometime near dawn. She didn't have to wait that long. As she scrubbed at a sink outside Or 9, a gust of bitter air swept through sterile corridors. Mira's reflection rippled on the stainless steel. And then Queen Silent manifested. Feathers bleached luminescent, neck coiled elegantly, eyes two onyx stones without corneas. She towered, wings brushing the ceiling tiles, crown tipped forward like a blade. Remove the right colon en bloc, the swan said, voice hushed yet absolute. That isn't involved, Mira countered. The mucin is mainly in the lower quadrants. Removing colon means a lifetime ileostomy. Remove, or the slime spreads, coats the liver, and stops his heart in 86 days. You cannot see every microscopic spore. Mira's gloves itched. I can perform HIPEC. We irrigate at 42 degrees Celsius. We'll drown the spores. Queen Silent's beak edged nearer. Too loud a poison for a fragile host. Cut the colon, place a brook ileostomy, and leave no drains. No drains? That contradicted every post-HIPEC protocol. Drains were lifelines, the early warning system for leaks. I don't even know if regulations allow. Children's fates rarely consult regulations, the swan hissed. Mira's breath condensed against her mask. She thought of the other creatures. Every instruction, however improbable, had proved right. Yet what if a hallucination finally erred? What if removing healthy colon sacrificed quality of life for phantom certainty? The calculus felt different when the price wasn't mere bleeding or nerve damage, but the permanent loss of bowel. I need proof, she whispered. Queen Silent's wings unfurled, revealing scenes across each feather like film reels. A colon wall stippled with invisible tumor nests, gray tendrils advancing. The same colon resected, stoma pink and alive. Javi skateboarding 5 years later. Vision or manipulation? Mira couldn't know. Surgeons operate on data, not prophecy. But data fails when time runs thin. She looked down the corridor. No one was there to corroborate or refute. She was alone with ethics and a spectral swan. Fine, she said, voice brittle. I'll remove the colon, but I'm leaving drains. That compromise stands. Queen Silent let a single feather drift to the floor. So be it, but the cost of half obedience will be your sleep, not his life. Then she melted into the fluorescent glow. The surgery stretched 9 hours. Mira's team worked in near silence, partly because of the procedure's intensity, partly because Mira radiated a resolve that forbade chatter. She harvested the colon, constructed an ileostomy, bathed the abdomen in heated chemo. At closure, she placed 2 Jackson Pratt drains despite a flicker of dread. The post-operative vigil began. Hourly labs, abdominal girth measurements, pain scoring. For 48 hours, Javi progressed beautifully. His white count trended down, ostomy output healthy. Mira allowed herself a microdose of pride, until day 3, when bile tinged the JP drains. A leak. They rushed him back to the OR. Mira traced the source to a pinpoint perforation along the distal ileum where one drain abutted bowel. A repair stopped the leak, and Javi recovered, but Mira did not sleep for 3 days straight. The swan's prophecy had mutated into warning: obey entirely or collateral emerges. When Javi finally zoomed his toy cars across the ward, his swan drawing had acquired new script: promise kept, debt owed. Debt to whom? Mira could no longer pretend the drawings were benign guardians. They were auditors, calculating risk and payment. Inscrutable as fate. She began to dread opening folders containing children's artwork, as if each was a subpoena. She took to storing them in a locked desk drawer, hoping to forestall new visitations. But art proliferates in children's hospitals. By February, she could have wallpapered the entire pediatric wing in sketches. Her breaking point arrived with twin infants, Noah and Natalie Brooks, born joined at the sternum and sharing a pericardial sac. Separation was feasible but perilous. Echoes and MRI suggested discrete hearts fused only by pericardium and a small vascular bridge. Mira knew the textbook steps. She'd assisted 2 separations during fellowship. The hospital scheduled surgery for March 3rd, giving her 6 weeks to assemble teams of cardiac, plastic, anesthetic, perfusion, nursing. 2 nights before surgery, she found a single drawing pinned to her office chair. A pair of wooden marionettes dancing on crossed strings, their torsos stitched together with gold thread. No parent admitted leaving it. Mira locked it in a drawer, unwilling to see them come alive. They appeared anyway, while she reviewed cross-sectional imaging at 2 a.m. Wood creaked, shadows stretched, the marionettes lifted from the page, full-sized, joints clacking. Their shared sternum gleamed, thread pulsating like a second heartbeat. "You will not separate them," the twin figures said in one overlapping harmony. Mira shoved her chair back. Separation is their only chance for independent life. Life apart is not always the prize. The twins glided closer, strings vanishing into rafters, manipulated by unseen puppeteers. "Your bone saw will nick the coronary bridge. One twin will code, the other will drown in surge. I can place safeguard clamps, separate the circulation early. Blood will find new rivers to drown them. Your plan ends in 2 funerals." Mira's throat burned. She recalled Queen Silent's admonishment about half-obedience. If she ignored the marionettes, would guilt haunt her once predictions proved true? Yet to cancel surgery meant condemning the twins to a lifetime conjoined. Hearts strained by adolescent growth, social isolation, complex care. "Tell me what to do," she pleaded. "Fashion a shared graft, reinforce the pericardium. They remain one body, 2 souls. When grown, they'll choose their own path." Surgeons seldom relinquish the chance to cure. Cure is oxygen. But sometimes survival triumphed over normalcy. She spent dawn rewriting consent forms, swallowing humiliation as she explained to parents why separation now posed undue risk. Miraculously, they agreed to postpone, citing trust in her judgment. The day surgery had been booked, Mira rounded on the twins in NICU. Each held one of her fingers, tiny nails like half-moons. She felt a wordless verdict settle over her. Mercy might wear stranger shapes than she'd been trained to recognize. Weeks passed. The marionette drawing altered again. Choice saved. A pattern crystallized. The drawings demanded not just surgical precision but moral calibration, less about living and dying than about how one chose between them. Mira stopped fearing the visitations. Instead, she prepared for them, reserving a chair in the on-call room, setting 2 mugs of chamomile tea. When figures emerged, an origami crane predicting a hidden vascular ring, a sock monkey advising a delay until cross-matching finished. Mira listened, negotiated, sometimes bargained, but always weighed their counsel as heavily as CT scans. Administrators noted her outcomes: morbidity down, length of stay shortened, mortalities near zero. They asked her to lecture on decision-making under pressure. She smiled enigmatically and spoke about humility, patient storytelling, and the importance of listening to voices outside conventional evidence. The auditorium applauded, clueless of the literal voices haunting St. Theodora's. She never discovered where the power originated. Collective hope, quantum bleed-through, hallucinations born of empathy. Yet by the time spring melted into summer, Mira understood something fundamental. Surgery was not a war waged on bodies, but a conversation with possibility. Children spoke through crayon, fear, fantasy. The drawings served as interpreters of stakes too enormous for tiny tongues. Late one June evening, Davy returned for follow-up, taller, lungs strong. He handed her a fresh drawing of Mr. Huff, smaller now, steam replaced by a shy grin. Underneath he'd written, "You're safe now." Mira tucked the drawing into her coat and walked the quiet hallway. No spectral bear followed. For the first time in months, the corridor belonged only to fluorescent lights and her footfalls. She wondered if the toys had finished their tutelage, that perhaps her own instincts, tempered by their guidance, were enough. But as she turned the corner near Or 3, a crumpled sheet of paper stirred. She picked it up. Blank. Possibility uncharted. Mira smiled to the empty air. "I'm listening," she whispered, and went to wash her hands, ready for whatever story the next child and the next inexplicable sketch might tell.